In this video, I will go over the histology of the respiratory tract. So there are three types of cells: squamous, cuboidal, and pseudostratified columnar cells that are in the respiratory tract. So first let me name these structures and I'll give you a clue on how to know which cells is in each of these structures. So here we have the trachea, bronchi, bronchioles, terminal bronchioles, respiratory bronchioles, and then finally we have the alveolar sacs. Now the reason I've made respiratory bronchioles and alveolar sac blue is that they're involved in oxygen exchange, and thus these two structures are referred to as respiratory zone. As for the histology of these structures, the way I memorize it is that 1 to 2 to 3 rule. So first let's go with the first one, then the next two, and then the next three. So the first one is squamous, the next two are cuboidal, and then the next three are pseudostratified columnar cells. You should also know that trachea and bronchi also contain cartilage and goblet cells. And finally, of all the structures that are listed here, squamous cells is the only one that is not ciliated. The rest of the structure, cuboidal cells and pseudostratified columnar cells, are ciliated. So just use this 1 to 2 to 3 rule to know that the first structure, alveolar, is squamous. The next two structures, which are respiratory bronchioles and terminal bronchioles, are cuboidal cells, and then the next three, which are bronchioles, bronchi, and trachea, are all pseudostratified columnar cells. And that concludes our discussion.